Welcome to EMA Provider Notes and Summaries training with Modernizing Medicine's EMA system. In this training, we're going to learn how to view patient charts, specifically to look at the chart notes that the provider writes at every visit. EMA is the electronic medical record. It's the tool used by finite clinics and employees to manage patient care and records. One of the most important pieces of this system is the clinic notes that providers use to keep record of patient visits. We will be going over this today. There are several reasons why you'll want to look at the patient's clinic notes or chart notes when you're dealing with a patient on the phone. These can include situations where you may need to inform the patient of how soon they're supposed to come back for their follow-up visits, what type of medications were being prescribed or spoken about during the appointment, the plan of care that the provider wanted the patient to follow, and other very important reasons as well, just to name a few. Once you've pulled up the patient by their date of birth and secondarily by their name, remember we always want to use that date of birth first, you're going to look on the left-hand side and you're going to see under the nav bar on the left-hand side that down the second one down, there's a link that says chart notes. When you look at the chart notes, you're going to click on that button right there. And it's going to pull up a list of all of the different appointments that this patient has come to. As you see here, all of the appointments have blue text on them, meaning that they're hyperlinks that you can click on. If you select the one from April the 27th here, it's going to pull up that visit's notes. Key components on this clinic note that pulls up once you click on the link include the chief complaint that you can see there at the top middle. And for this person, they were coming in because of a growth. You also see the HPI, which stands for the history of the present illness. Now, this is a 68-year-old female who's being seen about a growth, as you can see and read there under the HPI section. Next, you'll see the impression and plan, and this is what the provider is going to be doing, what they're looking at, what they think is happening, and what they want to do to resolve it. And it also tells us what the follow-up is going to be for this patient. And for this particular patient, 1 year follow-up is decided what is necessary. Down at the bottom, you can also see the staff that were in the room and that's examined the patient for this appointment as well. You see that Jamie Stevens was the provider that saw the patient and the one that is being billed under rather. And then Dr. Diab also was attending physician for this appointment. And that's basically it. Chart notes are rather simple. And once you start to look at a few of them, you'll get the flow of how the providers write them out and the type of information they put in them and the type of verbiage they use as well. So I highly recommend that you go into the chart notes when you can and when necessary. If you have any other questions about chart notes, please make sure to ask them to your trainer. Thank you.